Hello again, this is Dr. Giles. I'm the founder of Haywire and I teach people how to break their dependence on drugs and alcohol. My patients have included other doctors, chief executive officers, rock and roll and sports legends, and billionaires and homemakers. I'm here to share with you the very same information that you would get in the most expensive rehab facilities in the country. I do this because I don't want another person to suffer one more day without the information they need to live sober and breathe free. I want everyone to have the same shot that I had at a happy life. All right, let's dive back in with another very common question I hear all the time. I can't afford rehab. How can I get help? Can I get help? Of course you can. Now, inpatient residential treatment may be indicated for the most resistant or difficult or complicated individuals. The components of an excellent treatment program are available to you whether or not you have time or money to check into rehab. Let me tell you how. According to the American Society of Addiction Medicine, they have something called the patient placement criteria. Whew, a mouthful. But the most important determinant of the level of care they recommend is your acceptance of your situation and your willingness to get help. That's why the less you think you need help, the more help you need. This is where the word denial comes in. The more willing and participating you are, the lower level of care you need. The highest and most intense level of care is inpatient residential treatment. Next is an intense outpatient program, or IOP, where a person participates in therapy and group components in the day, but then they sleep at their own home. Next, less intense, is a simple outpatient program, and then the least most intense is getting some help putting it together on your own, finding professionals or people you can talk to. Now, if we assume you're watching this video looking for help and don't have the money or time, but if you did, you'd do everything you could about this problem, then it seems to me that you could probably put together the components that you need at really minimal cost. Now, the trade-off here is that you have to put in more effort. Like everything else, if you have less money, you have to work a little harder. No big deal, though. I know you can do it. When I look back at my own addiction and recovery, I was spending much more energy trying to survive and get loaded than almost anything else. Now that those things are no longer part of my life, I have time left over. So yes, you can absolutely get help. The three ingredients for successful recovery are education, community, and accountability. You can learn, you can ask for help, and you can do what you say you'll do. In my experience, people who do all three go on to have amazing lives and break their own dependence. Education in the age of the internet is abundant, and community in the age of mobile communications is literally at your fingertips. And accountability is up to you and the person you choose. If you keep doing the work required to stay sober, you will break your dependence forever. So there you have it. The more honest you are with yourself about your situation, and the more effort you put in, the cheaper help gets and the easier it is to find. I encourage you to explore the resources of Haywire and get the most information you can and learn about your problem. I also invite you to continue watching the rest of the videos in this series. Until next time, this is Dr. Jason Giles, founder of Haywire, saying so long for now, and remember, please be good to each other and be good to yourself. See you soon.